Hello and welcome. I am Diana Braun, founder of the Knee Zone, and I am so happy to be here live on a Friday. And I'm here to answer all of your knee replacement questions that you might have. Now, first and foremost, you might notice I'm alone today. That is because Dr. Sinha is, I'm going to do a little quiz in a moment here, but Dr. Sinha is here at his alma mater, and I thought, well, gosh, I don't want to let you guys down and not go live, so you're going to have me. What does that mean? Well, I'm not a surgeon like Dr. Sinha, also known as my husband and our co-author of Knee Replacement Secrets. So, to that end, just a reminder, not here to give you medical advice, but I did have both my knees replaced at the same exact time, which is not the norm, but I'm here to answer your questions. Oh, this is a great question, the listening canvas. I'm scared of the pain afterwards. So I'm assuming you haven't had your surgery yet. So let's talk about that. Your pain is going to be managed by doing three things really well. And this is for all of you that are like, oh, I'm worried about the pain. Yeah, you're having a pretty big operation. It's a big deal, but life-changing in such a positive way. So here's the deal. If you're worried about pain, first and foremost, and I talk a lot about this in our book, and yeah, this is a shameless plug for our book on Amazon, not gonna lie, but we come here free every week and give you lots of information. We answer your questions, but here's the deal about pain after knee replacement. First and foremost, your surgeon is going to give you prescription drugs to take that are helpful to manage your pain. You need to take them on the exact schedule you're told. Now, here's what happens to a lot of people. And I was in this zone. Had I not had adult supervisors, I probably would have broken the rules too. Because you're going to feel great, especially early on, because that nerve block is coming in from your knee replacement. And then you're like, oh, I don't need that the painkillers. I'm good. No. The reason it works is these are slow release drugs that are designed to keep that pain under what I think we like to say under like the 3 or 4 zone, not the 9, not the 10, 3 or 4. To keep to that 3 or 4, you got to take your pain meds on schedule. So don't be tempted when you're like, I feel good, I can skip a dose. No. You don't do that. Another key thing to keep your pain under control after your knee replacement, and we talk about it in our book, is elevating and icing with compression. You seriously, early on in your knee replacement, cannot ice enough. There's no, oh gosh, that's too much. You've got to do it as much as possible because that is actually going to keep your swelling down, which keeps your pain down. Make sense? Third thing is elevating your leg properly. I cannot tell you how many people goof up this really important step because, again, taking your pain medication on schedule keeps you comfortable. By elevating your leg properly, we're going to actually, keep the swelling down by elevating it properly. And what I mean by elevating it properly, and I always like to show this picture from our book, is it's the toes above your nose. That kind of elevation. We don't just sit with a pillow, especially do not sit with a pillow sitting on a recliner. This is another page in our book. You want to do it wrong? You want to be in pain? Sorry, Facebook friends, we're going to go back and forth. Be patient. That's how you do it wrong. So if you're worried about pain or you're in early recovery night right now and you're like, oh man, these are key things you need to do to avoid pain and not be worried about pain. Back to listening canvas questions. So yes, you need to have a very serious conversation with your surgeon that you do have, RA. They're going to do your medication a little different and your recovery. And Dr. Sinha has talked about this a couple times, and I'm not sure, we might have a video up on our YouTube channel at the Knee Zone on YouTube about RA, but specifically you're going to need to talk to your surgeon. I'm sure you already have. And secondly, they're going to do different things with your medication, and your recovery is going to probably take a little longer. And what I say for most people is complete recovery, as in you forgot you ever had your knee replaced, about a year. Now, I have people that post on my videos all the time, and I love you people that 2 weeks later are spreading topsoil and riding motorcycles and doing all the things that your surgeon would probably be horrified to hear you're doing. That is great. I got to remind all of you, we all enter this journey at a different age, different height, different weight, different medical history, and most importantly, mindset. All those things are going to play into your knee replacement recovery. So I say that with, let's all be kind to each other and realize we don't compare ourselves. Some people are going to actually recover faster than others. So with RA, prepare yourself. Your recovery might take a little longer, but you're going to have your life back and do so many things that you haven't been able to do that I really hope excites you in life. All right, everybody, have a great weekend, and you're very welcome so much. Bye.